Thank you for joining us here on the NPTE Final Frontier podcast. My name is Emily.
And my name is David. And today we will be interviewing Dr. Helena Esmonde. Helena is the co-founder and COO of Vestibular First. She has over 15 years of experience treating patients of neurologic, balance, and vestibular conditions. They have plenty of innovative tools over at Vestibular First, such as the Insight infrared video goggles, which she helped create and produce. She received her bachelor's degree in psychology from Northwestern University and graduated cum laude with a DPT from Marquette University. She is trained in depth for vestibular specialty at Emory University in 2015, certified to treat cervicogenic dizziness in 2016, and earned her board-certified neurologic clinical specialist in 2018. And she has a great history of teaching, including courses that could be found over on their website for Vestibular First. Welcome, Dr. Helena Esmonde, and thank you so much for joining us here on the podcast.
Thank you so much for having me. I think your work is so important. And as you mentioned, I teach at universities. I love students and I love lifelong learning. So I'm happy to be here.
All right, Helena. So let's dive right into our first question. How did you first become interested in becoming a physical therapist?
Yes, wonderful question. So I think most folks come into two categories when it comes to finding their career. One is, oh, I've known it since I was, X age. I figured it out and I was on my path. And the other ones are like, yeah, I kind of just like was floating along and I tried to figure it out. I'm the second kind. So I knew it was going to be medical. I liked helping people. I kind of knew what I didn't want. I don't want to be a doctor because, oh my gosh, it's like so many hours from what I'd heard. I don't want to be a nurse because I feel like needles are not my like favorite thing. Nothing against those dry needling folks out there. And then I was like, explored pharmacy. I don't want to be behind a counter all day. I explored nutrition. Nobody wants to hear they shouldn't eat bacon. It was just like me keeping like trying, checking out, observing, career observe, whatever, and no. And then finally I met undergrad at Northwestern and there's a hospital up there. And I'm like, well, let me just volunteer. Maybe I'll stumble across what I'm supposed to do. And they said, oh, well, we have an opening for a volunteer in the physical therapy department. And I'm like, what's physical therapy? And they're like, well, you can go see. And I'm like, great. So unlike most people, I did not get injured as my path to physical therapy. And I just went in there and was folding towels and whatnot, like any good PT aide would do. And I'm watching, of course, and I see this physical therapist working with patient, I guess you'd say, and they're like, oh, what do you want to do? What is your goal? Patient says, oh, I want to be able to pick up my grandkid again. And I'm like, whoa, that's cool. Like you can help a person like get back to like something that's super important to them just from like doing exercises. And, that's what I was observing. So that's what I figured. I didn't know about vestibular care at all at that point, by the way. And so I'm like, this is awesome. I'm in. So then I started focusing on, getting my prereqs and all that good stuff so I could go to PT school.
That is so incredible. And I think that it's even more special that you didn't have an injury, luckily, and you found your way towards physical therapy. And I spoke about it on the podcast before, but it's very similar to with me where I didn't have an injury specifically that led to it. And like you, I thought pharmacy, I thought this, I thought that. And then look at how we just ended up with our feet in physical therapy. So, how did you decide and when did you decide to create Vestibular First?
Another thing I stumbled into. This seems to be my life path, apparently. I'm just going to fall down and get up and figure it out.
Just as a vestibular rehab specialist should be, falling and stumbling.
You know it. You know it. We have to be able to empathize, right?
Yes.
So I had fallen in love with vestibular care at a hospital setting, and I wanted to do more following the patient through their plan of care. So I switched to outpatient, and I was working at a physical therapy place that was hospital based, full time. Awesome neurologic patients, vestibular patients. I was happy. But I had, got married, have a family, have 2 young kids, and we didn't have a grandma or grandpa or anyone to kind of help out when a kid was sick, or, oh, it's going to be a half day because of the snow or what have you. And so it became very stressful because where I worked, it was not highly flexible per se. And where my husband was working at the time as an IT consultant was not super flexible. And he was all the way downtown on top of it. So it became this stressful thing whenever something would come up. Well, who's going to, go pick them up? Who's going to deal with this? That sort of thing. And so we talked it over and agreed that one of us probably for the moment needed to go part-time to be more flexible to, kind of manage this. And being that IT on average does pay more than physical therapy, we determined that it would be me who would go part-time. And so I went to my workplace and said I need to go part-time. And they said, well, that's not possible with the role you're in. And I said, okay, well, I'm going to go look for another role just to let you know. And they said, okay. So I did that, and I basically went to an orthopedic clinic, a small private practice near me, and I said, hi, you didn't post a job, but I have these vestibular skills and I need part-time. Would you like to have me? And they interviewed me and like chatted over for like a day. And then they're like, yeah, sure, we'll take you. So I was like, sweet. But I knew that goggles, infrared video goggles, were to me a critical part of vestibular care, because in the hospital setting I'd worked at, I didn't have them. And when I worked in outpatient at this outpatient hospital-based clinic, I did have goggles. And so I knew the difference myself. I knew that was in the literature as well, but I was like, I'm not going blind. I don't want to be a cardiologist without even a stethoscope here. Like, I got to know what's going on. So I accept this job and I say, okay, well, will you guys buy me goggles? And they're like, well, we never had a vestibular therapist. How much do they cost? What's the deal? So I'm like, oh, let me do the research. Okay. You're like, $8,000 is the least expensive. And they're like, yeah, no, that's not in the budget. And especially with you being part-time, right? Like, understandable. From a business perspective, I respect it, but I'm like disappointed because, again, I don't want to be like working without them. To me, they're like actually the most critical tool that I have as a vestibular therapist. And so my husband, I mentioned he's in IT, he's got kind of a technical mind. He's like, I'll build you some. So I'm like, yeah, go for it. Try your best. So he's got a prototype on my desk in like a day, standard Patrick procedure. That's my husband's name. And he repurposed a virtual reality goggle and put infrared cameras inside. They worked well. I'm in a small private practice, as I mentioned, so they're not strict. Not that they were unsafe, but just to know they weren't officially FDA cleared at that time. Of course, they were a prototype, and so I'm using them. And my friends who are vestibular therapists are all like, "What are you using? Like, what's that?" And so I tell them, and they're like, "Well, will Patrick make us some because ours are old and breaking, and they've gotten so much more expensive." And so then Patrick and I sat down and talked over, is this a thing? Like, do we want to try to do this as a company and meet this unmet need of folks who want to do best practice care in the vestibular realm, but really can't afford? Most of the goggles that have been created in the past were really, I would say, built with ENTs and audiologists in mind, where they have a full suite of testing for vestibular care, as they should, for that realm. But it's just not feasible for physical therapists on average to have the space for that full suite of care. They're not billing for that because we don't have access to those V&G codes, they call them. So it was just like an unmet need. And so yeah, we started the process and got FDA clearance in November 2020 through a whole lot of paperwork. So good thing I was used to jumping through hoops. So yes, all of that extra writing you have to do in undergrad NPT school will pay off sometimes in ways you couldn't imagine.
That's
No,
wild.
that's amazing. And I love how innovative not only you were, but you and Patrick, your husband. I love to hear people working together. And not only is it to benefit your company and your patients, but this is going to help so many other therapists who, like you said, maybe can't afford those high-end goggles that have more than maybe what we need as treating physical therapy clinicians. So that is absolutely amazing. Now, let our listeners know, what is one thing you feel could be done to make the physical therapy profession better, and maybe even more so the vestibular physical therapy population?
Yes, no, that is, as they say, a loaded question because, of course, I want to think of 100 things because I have a lot of enthusiasm for helping growth. But I think the number one thing that is valuable that I think happens a lot, but I always want it to happen more, is what I'll call knowledge sharing. So I'm a big knowledge sharer at Vestibular First. We do bi-monthly journal club. It's free. We record it, we post it up on YouTube. People can watch it anytime. And from a financial standpoint, people say, "Oh, well, yeah, you're making it free, but it's basically marketing," and that is true. But I think some people think that marketing is a bad word or something like, "Oh my gosh, you're just trying to like make me drink more Coca-Cola." But no, I am just trying to let people know about something that if they have a need for it, they can know, oh, hey, this is out there for me. And again, it's quality, it's affordable, this is a good product. But ultimately, if someone watches all of our journal clubs and never buys a product from us, I am personally totally okay with that because it's still lifting up the profession. We really, think about competition, and that is not my MO. I am all about like if we just work as a common community to lift each other up, and that could be including a challenge like, okay, can I do this better, faster, stronger, and that helps everybody. I'm good with that competition type. But ultimately, um, you know, I'm happy to, balance out the fact that yes, we have value. We should not be undervalued. So yeah, I might do a speaking gig for pay or something. But ultimately, there's a lot of little and big ways that we also, as we accumulate opportunities over time, to give back and share. And so, I have gratitude for so many people who have shared knowledge with me in various ways, both paid and unpaid, both awesome. Like, you know what I mean? And so the more I can do of that, um, I think working in acute care, perhaps you just definitely are like, oh my gosh, I'm definitely going to die. And someday, I don't know when. So, like, what maximum value can I put out while I have this chance? And,
Yeah.
like, that's what I'm in for. Like, that's what drives me. And, ultimately, I think that if we can all, like, have more of that mindset, I think that, we can be happier and we can really have our purpose. There's like a Japanese version of this that really talks about finding something that is enough that you get paid to, you have plenty of money to live and have a house and all the good things you need, but also fulfills you emotionally and spiritually and also helps your community. If you can find something that fits all of that, like that is like the closest that I know to the meaning of life and happiness. So I'm in for it.
Yeah, it sounds like just really finding your passion out there,
Yeah. Yeah.
you
And if
know?
I can help other people do that in some way, like that's super exciting too. So
Yeah, definitely. So now that you spoke about the business and how it got started, what was one of the biggest difficulties that you faced when starting up your own business?
yes, yes. So you might come into starting a business with a ton of business knowledge, and if so, good on you. That is not me. Uh, and, I have learned quite a bit over time. But on the other hand, I have also learned that it is healthy to really, you don't have to know and do everything. I mean, it's admirable if you want to grow and grow business knowledge or grow financial bookkeeping knowledge or what have you. But if you can find ways to also just find really good people to be a part of your team and to handle those things and or to teach you at least, like that is key. So this business was not built on just one person. It's not built on me and my husband. It was built really through our community. And I'll say that through the vestibular community, all of the awesome therapists who tried our first version, gave us feedback, all of the folks who were willing to endorse us and support us in the early days and say, yes, this might be like, a new product and we didn't have like a established 20-year reputation yet, but, give it a try and that sort of thing. Folks who were willing to say, oh, I know a good lawyer who's not, so expensive that would help you with this legal aspect for your business. And so, the list is lengthy. I could go on. Um, but ultimately, like, again, I'm filled with gratitude because, to me, it's about, having a good connection, but then also like be willing to ask and say, I don't know everything. Like, will you help me? Like, yes, of course, like pay you what you're worth whenever I can. Some people gave us their time for free, and that's wonderful and kind. And I'm especially grateful for that. But I want to pay everyone what they're worth for the services that they've provided, from our manufacturer, our regulatory consultant. It's quite a bit. But again, I didn't feel like I had to know and learn and memorize and know everything. I just had to be really good at some certain things that I'm really good at, which is, of course, I get to be the clinical piece and help with that aspect. Like, oh no, we cannot make the groove in this part of the camera unit, that narrow, because then if a poor patient gets sick on it, you won't be able to clean that out. And my engineers are like, huh? And I'm like, yeah, could be a thing. So, I have my contribution and that kind of feedback, amongst other things that I was able to do. But honestly, it's not about me. I guess that's how I think of it. Like, I think about Vestibular First. Am I proud of it? Yes. And have I been a big part of it? Sure. But like so many other people have been such a big or little part of it. And so it's really like a stained glass window to me.
I really want to magnify the fact that you mentioned the team approach because I think that is so important. And especially over at Final Frontier, I am very fortunate to be in such a role that has such a team approach as a company as well. And I truly think that's what helps companies grow is to get different perspectives, different insights, know your strengths and weaknesses, and which team players can really help not only promote efficiency, but quality. So I think that is great to hear from you guys over at Vestibular First as well. Now, what is one piece of advice you would give specifically to physical therapy students?
Mm, yes.
Another loaded question.
Yeah, no, that's great. I mean, maybe other people have said this. I'm just going to say what first comes to my mind and feels most strong in my heart, which is really try to have an open mind. You know, if you had asked me in physical therapy school, are you going to be a vestibular therapist? I'd be like, I think that vestibular word got mentioned like at the tail end of a neuro class once. I don't really know what that is, so probably not. And, this is a few years ago when vestibular as a area of our profession was definitely just growing and not as strong as it is now. And it continues to grow, which is great and exciting and needed. But yes, I graduated physical therapy school in 2005. So there it is. Um, so there's that piece. And then also, if you'd said to me, oh, Helena, you're definitely going to be a medical device co-founder, I would have completely laughed in your face and said, yeah, that is not my path. I am definitely going to treat patients forever. Maybe I'll do a little bit of teachings or something. That was like kind of as open as my mind was in that moment. So, I think sometimes when we don't know what our life is going to look like, it can feel daunting and overwhelming. And oh my gosh, and am I going to figure it out? But there's this beautiful quote from Rilke, and the tail end of it is the one I can quote exactly, which is live the questions. And when I stumbled upon that quote several years ago, I'm like, oh my gosh, this is so life. Because chances are, at every stage of your life, if you want to call it that, you have questions you're living. So at some point, I was like, oh my gosh, am I going to graduate PT school or am I going to fail out? At another point, I was like, oh, am I going to pass the boards or am I going to fail that? Oh, am I going to get a job or am I going to just struggle to find a job for a year? And then it was, oh, am I going to stay in Philadelphia or am I going to move somewhere else? And you could definitely list your own questions, right? Or you could think to yourself in your head, at various points from when you were in kindergarten or even however back you have a memory, mine is about kindergarten, on, you were living questions. And so instead of being overwhelmed by the questions, I've really tried to learn, I think this is some sort of meditation situation, to embrace the question and say, okay, I'm present with the question. I'm going to keep gathering information. I'm going to observe. I'm going to experience. I'm going to, listen and find different ways until the question gets answered. And then that question, hopefully is at rest, or maybe it evolves into a different question, and then you just keep living the questions. So if you can live a question as a student and say, okay, what's the questions that I'm working on right now? And maybe not focus on the ones that are like 10 years out. Like, am I going to be a medical device co-founder? You'll figure that out at some point. Many of you, maybe not. A few of you, I hope. Yes. Do that. So let me know. I'm happy to help you with what little I can offer in the way of my experience. So if again, we can lift each other up, and then the questions can be less scary, and you will find your way. And that is really about, yeah, the little people call it living in the moment. But to me, it's more about being comfortable with not having all the answers and still being content.
That's awesome.
Yeah, and I think to go off that even further, you mentioned having an open mind for students, which I think is so great because, like you said, some people go into physical therapy and they really don't know where they see themselves yet. Other students I've seen, think they have it all figured out. They know they want to be an ortho or a neuro specialist, and they come in and they are so passionate about that, which there's nothing wrong with that. But it's
No, right.
also okay for your path to change along the way.
Yes.
For me, I thought I was a neuro junkie. I thought all I wanted was neuro, neuro, neuro. Then I realized in my area, there's just such a lack of pelvic health specialists, and there's really a
Yeah,
need for women's health, especially because there's just a lack of care in my region. So
right.
my passions kind of changed, and now I'm going more the pelvic floor route. And it's okay for your passions to stay the same your entire career. It's okay for them to change. Like you said, that open mind, being able and comfortable with yourself for those paths to change and try new things. There's nothing wrong with that because it may open an amazing door you never even thought of
Yes,
earlier on.
yes. And transferable skills, right?
Hmm.
So I didn't ever think I was going to be a peds PT, but I did do a peds rotation because I was curious
Yeah.
and I had the opportunity. And it ended up in one that was kind of unique because it was adults who had severe developmental disability. So we might be working on what I'll call pediatric goals, but they had the bodies
Mhm.
of adults. And I got a lot out of that rotation. And one of the things I got out of it, as simple as this sounds, is really good creative positioning to prevent wounds and things like that. And then when I was in acute care, I'm like, I got 50 ways to figure out how to get this patient, set up to hopefully less likely, I should say, to have, say skin issues. And so, that might sound like a small thing, but we all know that skin issues can lead to huge problems. So when you have an openness of mind to say, okay, I'm in this setting, or I'm even got assigned to some clinical that I'm not excited about, just try your best to really take anything out of it you can, because you will be surprised how you can pull those transferable skills in ways you couldn't have imagined, and really to benefit, you and your future patients as well.
That's really amazing and incredible. So, you brought up the medical devices. You have medical devices in front of you. Please show off your medical devices. Let's see. What do you have over there?
Oh my gosh. So, all right. So I've mentioned the goggles several times. For those of you who've already had vestibular course, I hope that you got to use goggles during your training when you were having lecture and lab. And if you didn't, I hope that you will somehow get a chance to be familiar with them. And if you never ever do vestibular care and that's not something you pursue, please try to send your patients that have vestibular issues to clinicians with goggles. And it does not have to be Vestibular First goggles. I'm just saying it is a standard of care. And it's something that, like many things in physical therapy, especially when they were less affordable, of course, people were like, oh, that's a nice to have. But the reality is, for what the literature is out there, and I could quote you studies, but at the end of the day, just I hope you trust me. I can also point you online on my website, lots of stuff on there about that.
We trust you.
But it's really, yeah, thanks. It's really a passion of mine, because I've had patients come to me, and maybe it was the clinician's comfort level with a difficult patient as well, meaning like one that has a lot of complexity to them. When I say difficult, that's what I mean about patients. So a complex patient, maybe multiple issues, et cetera, as far as diagnoses and so forth. But all I can say is that, for me, the goggles, total game changer as far as upping my confidence, and when I was a newer clinician, being able to have a video, talk it over with a colleague, a mentor, all of that. Like, it's just so empowering, because there's really a great opportunity for us as physical therapists to be a part of the diagnostic process. And I'm not trying to displace physicians, but honestly, they pretty much want me to be figuring things out and then appropriately referring as we do, right? So if I'm like, oh, shoot, I'm seeing a lot of eye movements, it tells me something probably going on with the brain, but I don't have a diagnosis in their history that fits that, they need a workup. because we want to sort this out. We want to be advocates for our patients. And we know, especially with direct access, which, most of us are having in the outpatient world, and even in inpatient side, sometimes you're the one who sees something at a certain moment, and you're that critical piece to tell the doctor, hey, I was assessing, this vestibular piece, I saw this, I'm concerned about this, or I was able to address it. It was just the crystals. Yay, we love it when it's the crystal problem, and we can just put the crystals back and be amazing magicians. Uh, so, for me, that's the cool aspect of the goggles. There's a lot more to, kind of getting comfortable interpreting eye movements. That's something you can get training on. We have a lot of resources, again, free and CEU level. And I'm happy for people to reach out to me if they have questions about that. Whether you're a very brand new grad and you think you want to get into vestibular care, whatever you need. To me, that's all about, again, lifting each other up. And, as far as educational tools, which is our other set of products, plus some courses, I guess we do have those as well. But these are definitely pretty much the only ones out there. So I'm proud to say that we really worked hard with researchers to make these anatomically accurate for the fall rate of the crystals. I just had the opportunity to be at St. Joseph's University in West Philadelphia, teaching with Dr. Ann Galgan, who's brilliant in her field, well published. And so I get to teaching assist for her. And, the students are just I really, literally, I'm with a group of students and they're like, well, why this? And I'm like, hang on, let me get a model. And they're all in other students' hands. And I'm like, I should have brought more. Because, the vestibular system is tiny. Okay, guys, you might know this. It's about half the size of a dime. Okay, really tiny. So, the problem is that when you have such a tiny vestibular system, it's not as obvious as the elbow, right? Okay, we all have an elbow. We can all wiggle our elbow. And then when we're practicing, we're wiggling each other's elbows. Well, how do you practice with a tiny system that's, in your inner ear? And hopefully most of us have normal eye movements. So it's not like we're going to get to see any kind of pathology there. So it's really helpful to have physical models of the vestibular system. The headband for students is my personal favorite. So if university does not have one of these, I would encourage them to get one, just because, again, the students were like, oh, who is the headband? I want to put it on me. And let me see how that maneuver would clear those crystals for that person with BPPV. Because, again, of all the vestibular conditions out there, and there are unfortunately quite a few, BPPV, those little tiny crystals going out of place in the inner ear, is something that's definitely fixable, almost always. So it's very rewarding. So even if you really only want to know a little bit about how to do that, and then you refer every other patient and the more complex BPPV to your vestibular specialist in your area, that's fine. Again, I don't judge you. I'm not trying to do every specialty, so I don't think you have to either. But if you have enough knowledge to know when to help, when to refer, and have some tools for that, I am 100% with that.
That's awesome. And you should know that Vestibular First model, education model, Vrunda actually uses during the classes to show the students. And I remember when she won that for the contest,
Yeah.
very proud moment to show that off. So definitely it is a great model that everybody should be checking out. But now it is on to, you don't know this question. It is our podcast special. We do a special surprise question for all of our guests. So, you are a fantastic water painter. Your water paintings are incredible. I have seen them. And you do this on your free time. What is your favorite painting, or who is your favorite painter and why?
Oh my gosh. Again, you have to give me hard questions because there's so many awesome artists out there. I'm going to go with a classic, and maybe I'm inspired because I'm going to France for the first time in August. So I'm super excited about that. Yes, occasionally, even when you're treating patients and running your own business for a medical device company and raising children, you might be able to still go on vacation to France. So it's been a long time coming, but it's happening. But Renoir is awesome because when I think about painting, there is something about a painting that ideally gives you some sort of feelings. Maybe they're, of course, up to how you're feeling in the moment. So, two people can look at a painting. One person's, wow, that's so peaceful. And the other person's like, oh my gosh, that looks kind of dark over there. And that's okay. because music and art to me are absolutely about yeah, living the questions, processing your feelings, like, allowing yourself to be immersed in something, again, music and or the visual, to, I don't want to say escape, but just kind of free your mind a little bit. And again, that's where ideas might come to you, or something that you had been thinking about and you stop thinking about, and all of a sudden you're like, oh yeah, it's the febrile artery. Like, you know what I mean? Like, so, I hope as students you give yourselves little opportunities, whether that's through art or music or just taking a quick walk, good old exercise. We all love that. But, to be in nature, get that oxygen, whatever it takes to kind of help reset button your brain, which is one of my favorite terms for my patients with dizziness, because we do something, we might make them feel a little dizzy, then we have to kind of settle and reset button the brain, because we're training the brain, we're training the neurons to connect. It's beautiful, and that's part of learning and studying and all of those good things. So for me, art is really a part of that, and to create is definitely very exciting and totally makes me less afraid of failure. Because with art, sometimes you're like, oh, this did not turn out the way I look. Fine, rip it out, start over. Like, it's a detachment. My husband does pottery, and he teaches classes sometimes, and he will make them cut in half their first piece of pottery that they super are proud of. But he says it's really important because pottery breaks. So even if you, fire it and everything, at some point it could break. So it's really healthy. Not that you can't love and be attached to people and things and where you live and whatnot, but also to like have, again, that openness to say, okay, like this too may pass.
Mhm.
And sometimes you want it to go away, like, oh my gosh, I just want to graduate and be done with school. And other times you're like, oh, I miss that experience or person, and kind of being able to find ways to process those emotions. To me, art is a big one. So yeah, Renoir. Woo.
That's huge. Emily, I'm going to hit you with it. Do you have a favorite painting or painter?
Oh boy, you caught me on the spot too. Honest, honestly, I'm gonna be fully honest and transparent here. I'm obsessed with the American Gothic painting when they're
Yes.
customized with like different dog faces, families, cats. Like, I just love how such a famous traditional painting has just been tweaked and customized so much throughout the years, and how much just like creativity it brings to art.
Yes. Yes.
That's a
What
good
I'm
about
one.
not
you,
a
David?
Bible quoter, but one of my favorite quotes of the Bible is there's nothing new under the sun, because the reality is that most of the time people are like, oh my gosh, that's such a novel idea. And the reality is we're all kind of picking up little pieces. And even if it looks novel, it's come from some pieces of other things somehow.
Mhm.
And so, don't judge yourself too harshly is what I'm saying. If you've been inspired, yeah, that's awesome.
I love it.
That's
David, what about you?
all right. So I did prepare for this question, and I have to go with Vincent van Gogh, Starry Night. I do,
Nice.
I,
Classic.
I do love that painting. I got to see it at the MoMA in New York City. So if anybody's in New York or visiting New York City, Manhattan, make sure if you enjoy paintings and stuff like that, go to the MoMA, go see Starry Night. It is so beautiful. It's something about just seeing the beauty of the different swirls, creating an image, and also I am a Doctor Who fan, and there's an episode featuring Vincent Van Gogh, so definitely gonna go with Starry Night.
There we
There
go.
is a theory that Vincent van Gogh had vestibular migraine, and what he painted was the scintillations or sparkly burst that some people with migraine will see when they have visual aura.
That's
Huh.
awesome.
I could definitely see that too. That's
You
interesting.
are a wealth of knowledge.
You know what? Some would say in very specific areas. I can't fix a car. I'm only a fair cook, but I have a lot of other specific
You've
knowledge.
got some good trivia categories covered. All right. Well, Helena, thank you so much for joining us here on the podcast. This has been so helpful for our listeners. I know it's been helpful for us. How can our listeners get in touch with you or find you on social media to learn more about you and Vestibular First?
Sure, sure. So we've tried to make it easy by being consistent. So it's at Vestibular First for Twitter, Instagram, Facebook, TikTok, and LinkedIn and YouTube. Yeah, that covers it all, I think.
That's nice and easy.
That is perfect. Well, thank you once again for joining us. We do appreciate you, Vestibular First, and everything that you're doing. And we look forward to having you on our podcast in the future again.
Thank you. Same. It was really a joy.
Thank you. Now that you heard our interview with Dr. Helena Esmonde, here is a quote from Charlie Chaplin. You'll never find a rainbow if you're looking down. Keep on going forward. Keep your focus on your goals. Keep on pursuing your dreams. Try to stay as positive as you can and keep on chasing your rainbow. You are going to get there. You are powerful. You are strong. You are a final frontier warrior. You will pass.
Thank you very much for listening. For more information on NPTE Final Frontier, please visit NPTEFF.com. You can check out all of our social media platforms such as Facebook, Instagram, Twitter, and TikTok.
Till next time, have a great day and a powerful tomorrow. Thank you once again.